Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. My guest today is Kate Favreau. Kate is with the St. Lawrence Valley Hospice and she's their outreach coordinator. She's here today to talk to us about making that first call to hospice when the time is right. Kate, welcome back. We've been
Thank you.
doing a whole series this year on hospice and the services you offer. And this is an important topic that we're going to talk about today, isn't it?
It is. Yep. I think increasing the comfort level and knowing what to expect when you make that first call makes that first call just a little bit easier.
Yes, I agree. And so this is basically how to get started with hospice, isn't it? The first thing to know is when to call, and sooner is always better than later, isn't it?
Absolutely, yes. So we would like to see people once their doctor has said they have about 6 months or less to live. If you call us as soon as you hear that sentence, that means that you can get expert end of life care for the full 6 months and potentially even longer, right? Because we know that not everyone is going to die within those 6 months. But the sooner you call, the sooner you get the help that you deserve at the end of life.
Right. And in fact, oftentimes what happens is with the support that hospice offers, it kind of gives the person not only more time, but a better quality of time, doesn't it?
Yes, absolutely.
So let's talk about making that first call. What's that going to look like? We're talking about a medical situation, so we need to be thinking about the kinds of documents and information that you should have when you are ready to call. The last thing you want to have to do is to start looking up things on the fly when you're trying to be on the phone, aren't you? So let's detail what people need to gather to make that process easier to get started with.
So I'm going to say our phone number a lot during this one, but you're just going to call 315-265-3105 and ask for the admissions coordinator. Her name is Amanda, and she is going to walk you through step by step what happens. And when you make that first phone call, all we're going to need from you is a short explanation of what's been happening with the patient. So, have they been in the hospital recently? Have they recently decided to stop treatment? Did they recently decide that, given their diagnosis, they're interested in learning more about hospice, even if they're not ready for hospice? You'd still talk to admissions for that. Our admissions coordinator, Amanda, she'll talk about the criteria for hospice. So, what do you need to qualify for hospice? And also, what can hospice do to help you and your family through the end of life process? And then she does a lot of work. She gets all of the records. The only thing we need from the family or the caller is the patient's name, their date of birth, whoever their primary care provider is, and whatever doctors they've seen recently. So, if there was a recent hospital stay, or whatever specialist they've seen, if that's applicable. And then Amanda goes and she gets all the records. So you're not looking things up on the fly. You just need to know patient's name, date of birth, primary care provider, any other doctors they see, and she will collect all the information from there.
Well, that's good to know because, of course, sometimes you worry about is there an insurance piece? Are there other kinds of things like that which people can sometimes feel a little bit panicked about. So I'm not sure. I'm not sure what that information is. So that's good to know that it's a pretty straightforward process. And so you talked about the steps and what happens with each one of those steps after someone has made that initial call. They've spoken with Amanda and she's got the ball rolling in terms of getting their medical records. What happens next?
So once we have those medical records, they will go to one of our medical doctors here. And that's just to certify that, yes, they agree with whatever doctor has made the referral and is seeing that 6 months or less thing. With that said, it doesn't need to be a doctor that makes the phone call. Anybody can pick up the phone and make that call. So it can be the patient themselves, it can be a family member, it can be a neighbor, a healthcare proxy, a concerned clergy member. Anybody can make that referral. We do prefer that you talk to the patient before you make that call. But anybody can pick up the phone and initiate that referral process. So once we have the records and the doc looks them over, the doc will typically approve the patient, and then our staff will get to coordinating with all of the DME companies, so the durable medical equipment, if you need a hospital bed, if you need oxygen, if you're in the hospital and you're coming home, our staff's going to coordinate with the hospital to make sure that our nurse is at your house when you get home from the hospital. So there's not like a big gap and you're not waiting to get on hospice. We can streamline it pretty quickly. And all of that happens in about a day. So there's no long wait. It's just one business day, and we can usually get everything kind of lined up. If you're not going to be discharged from the hospital in a day, that's okay. We can schedule the admission out a little bit longer, but there's not a very long wait time at all.
So you mentioned, Kate, about it's important to talk to the patient, but we know that sometimes patients are not competent to make those decisions because of dementia or Alzheimer's or something like that. How does that situation come into play? And, who then starts making decisions when the person can't make it for themselves?
Right. So if the person cannot make the decisions for themselves, hopefully they've already designated the healthcare proxy. So the healthcare proxy is going to be that person, and we've talked about this in previous
Mhm.
episodes, that is legally able to make medical decisions for the patient if and only if they can't make them for themselves. So ideally, we would love for there to be a healthcare proxy in place. If there's not, things get a little more complicated. So just another plug to do your advanced care planning as soon as possible.
And that's a really good point because it's the sort of thing that's easy to slip off your radar screen. And oh, yes, I meant to get to that. And then all of a sudden, you're at that crisis point and you've got to rethink how you're going to do these things. So at some point, the hospice nurse will come in to do an evaluation of the patient and the needs that they have. What will that look like? What can we expect during that visit?
So you can expect one of our nurses to come out to your home. They're going to be there about an hour. So they're really getting to know you. They're getting to know your family. They're going to review all of the medication that you came home with. They're going to do a full nursing assessment. So they're going to do all of your vitals. They're going to test all of the things that they need to test to give us a baseline of where you're at. They'll look at whatever equipment needs you have. So if you need a bedside commode, if you need an over-the-bed table, they're going to assess for things like that. And then they're also going to talk with the family and the patient about, would you benefit from getting support from one of our home health aides? So do you need support bathing? Do you need support kind of changing the linens for the patient? Because sometimes that needs to be taught to families. That's not a skill I have for sure, but I remember hospice teaching us how to reposition my grandma.
Mhm.
And they'll hook you up with a home health aide if that's something you and your family feel you would benefit from. And then they'll also talk to you about hospice volunteers. So would you benefit from someone coming in and sitting with the patient while the family steps out and maybe runs some errands or maybe just takes the dog for a walk, giving the family a break?
So there is a respite care component to this as well, in that sense that you can keep the caregivers healthy while they're
Yes,
giving care,
exactly.
right?
Yes.
So,
You do
so
have to take care of yourself to take care of other people.
that's right. And it's something that's easy to fall by the wayside when you are so consumed with trying to make sure that the patient has everything that they need to be safe and well cared for. So once the patient has been established with hospice, there will be ongoing visits and evaluation. How does that work, and how will additional needs be met as time goes on?
Sure. So our hospice patients are visited once a week, at least by a nurse. Visits can happen whenever is convenient for the family. So some families are early birds and they would like a visit at 9 a.m. They just let the nurse know that and she can work that into her schedule. Some families much prefer a 2 p.m. visit and she can also make that work. So you're going to see your nurse at least once a week. If you and your family have opted to have support from a home health aide, they're usually visiting 2 or 3 times a week, and those visits can happen over the weekend. So if you need a little more support during the weekend for whatever reason, that's certainly an option. Nursing visits are also on an as needed basis. So if there's a crisis and it's the middle of the day and your nurse isn't scheduled to visit until Friday, you can call the office. We'll get in touch with the nurse and the nurse can make an emergency visit if needed. It might take them, because we do cover all of St. Lawrence County, so it might take them an hour or two to get there. But we're usually pretty good about dispatching. If there's a more local nurse during the day, we can do that. And then there's also on-call nursing support 24/7 as well. So the nursing is at least once a week. Home health aides are a couple times a week. We do provide holistic care for our patients. So each patient and family also has access to an assigned social worker. And those visits happen once or twice a month, more if the family really benefits from talking about what's going on, or they need help with Medicaid applications, or they need help facilitating like a family meeting, for example. Social workers are able to do all of that kind of stuff. And then we do have a spiritual care coordinator who also visits once or twice a month or as needed. So sometimes he'll be tasked with going out a little bit more frequently as the patient trends more towards the end of life. And then once one of our patients is determined to be imminent, which is that we expect them to pass within about 24 hours, the nurse will visit every single day at that point, so that there's always someone there to make sure that things are going the way they should be going and educating the family on what's normal and what to expect at that point.
You make a great point about that because for many people, this might be the first time they've gone through that particular scenario, and not knowing what to expect just adds to all of the trauma of the whole situation. And the fact that your people are there every day makes such it's something to look forward to. Everybody has questions, and obviously towards the end the questions multiply. So having somebody there is so important, isn't it?
Yes, it is. And again, these are not quick visits. The nurses are there to educate you and make sure that you, as the family member who's taking care of the patient, knows what to expect and knows how to respond to what's happening. So there are going to be visits every day when that end of life approaches, and they're not just quick check-ins, unless that's what the family wants. If the family has it well in hand, we can certainly leave them with that responsibility, but we are always there 24/7 as well.
And the peace of mind that brings. But again, it comes all the way back to that first call, doesn't it? You can't
Yeah.
get that peace of mind until you make that first call. So, Kate, let's remind folks how to get in touch with hospice as we come towards the end of the show, so that there's no question in people's mind that they should call, they can call, and you want them to call.
We do. Even if you're just calling to ask for information, you're not sure how hospice works, you're not sure if hospice would be helpful, you can pick up the phone and call 315-265 3105 and just ask for admissions, and that'll get you to Amanda. Again, if you're not really sure it's the right time to call, just call us. We'll walk you through it. If it doesn't seem like the right time, we'll let you know. We'll also educate you on what to look for indicators that the right time might be approaching soon. So you're under no obligation if you call. We're not going to immediately rush out and sign you onto hospice. We're going to talk to you about how hospice helps, when they help, and who they help. And if you fall in the who they help category, we can certainly start that process. If you're not there yet, that's okay. But there's no obligation, even if you just want to call to learn more about hospice in general, because people don't know. Like you said, a lot of people haven't been through this. So calling just for more information, also an option. But if there has been a 6 month or less time frame, calling to get the expert care you deserve at the end of life sooner makes a big difference. So you would just call our office 315-265-3105 and just ask for admissions.
Kate, let's also take a minute to talk about your hospice website, because you have a lot of information on that that can maybe be a good starting point for someone who's in the exploratory phase of trying to figure out if hospice is the right call to make. So talk to us a little bit about what you have on your website for folks.
Sure. So our website is a wealth of information, as you said. There is a little bit of a quiz that tells you if palliative care, so our AIM program, our Advanced Illness Management program, might be appropriate for you, or if you're trending more towards hospice level of care. Um, our website does a really good job of breaking down the difference between hospice and AIM. And then it also talks about the hospice concept. So what hospice actually looks like and how we as a hospice help people in their own homes. There's a pretty big misconception that our hospice has a hospice house that people can come to. Unfortunately, that's not a resource we have in St. Lawrence County, but we do meet people where they're at in their family homes, which I think is invaluable, truly. But the website also covers grief. So if you're struggling with grief over a hospice patient's death or just any death in general, there's a wealth of information and resources on there for that. We also have an application for volunteering if you feel like helping someone get a little bit of a break is something that you would have time for in your life. You can find information about that on there. And then we also have our business partners. So our hospice is supported by quite a few local businesses, and we would not be able to do what we do without them. And all of those are on our website, and then also more information about how to become a business partner. So it's got a range of information and it's accessible and easy for everyone to get to.
And that's so important because when you're searching for information, you need a place to start, and the hospice website is a great place to start. And I'll be sure to put that link in our show notes so that people will be able to find you as easily as anybody can find you pretty easily because you're very visible on the web. So. Well, Kate, thank you. This has been a great series in this last few months about talking about what hospice is, what it can do for people, how to access it, and what the various levels of options are for folks, as well as the grief counseling, which you and I have talked about before. So, all those things are important components as people deal with the end of life process. And not easy to deal with, not easy to talk about, but there is help available.
Yes, absolutely. And the sooner you call, the longer you get that help.
And that's so important. So, Kate, thanks again for all your help in getting this series out for people. We will look for maybe some new information from you as new resources become available. But it's been a great series, and I appreciate all the time you've devoted to this for us.
Thank you. It's been a great experience for me too. This is my first series with you guys, and this I think is just a fabulous resource for the community.
Well, thank you. So, these conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.